Good afternoon, nurses. I can see na medyo there's still a few participants. Let's wait for a few minutes for more participants to enter. All right. Hello, good afternoon. So for today's session, we will be continuing endocrine system. Okay? But however, we will just wait for quite a few more participants. Baka yung iba from duty pa, ganon. Maybe they can still enter the live session or the live review. Okay, so we will start at 5:15. Be grace period 15 minutes. So please prepare your notes if ever nagno-note taking kayo dyan. Prepare yourself a cup of water or coffee dyan. Alright? Sige. Hello, Team Bullet. Once again, good afternoon. And yes, we will start already. So, for this evening, we will start the session with your Addison's disease and your Cushing's syndrome. Okay. But before I begin, I just want to check. I audible. Can you hear me po? Can I have any reactions or any comments sa chat? Um, am I audible? Is my voice clear? Okay, very good. Sige, let's begin. So, just like with yesterday, how I'm going to do this is parang yung slide na ito, it's just a preview of what you are to expect when we will be discussing about your Addison's disease and your Cushing syndrome. I am going to be discussing them in depth after showing all the information here, all right? So, when it comes to your Addison's disease and your Cushing syndrome, we know that there is a hormone dysfunction. Okay, there is an imbalance of a specific hormone. And what hormone do you think is it? What hormone yung may imbalance when it comes to your Addison's and your Cushing's syndrome? Very good. Your cortisol, or those are your ACTH. Okay, your ACTH. So let's start. The cause, one of the main cause of your Addison's disease is your idiopathic autoimmune disorder. It means it is an autoimmune disorder. So the body, it basically says that it's your own body of targeting your own body. Okay. Next is signs and symptoms, we have hypoglycemia, hypotension, hyponatremia. We also have your hyperkalemia, bronze-like skin, fatigue, or weakness. All right. Afterwards, after when we will be discussing it in depth, I will be showing you, or I will be giving you tips on how to easily remember the signs and symptoms when it comes to your Addison's and Cushing's disease. Remember, it's mahirap siya if you will memorize it because of course there's going to be a lot of different signs and symptoms, so it's going to be quite difficult to really memorize. So the goal here is to understand the disease process. Para just like yesterday when we were discussing about your diabetes insipidus and your SIADH, once you understand ano ba yung nangyari sa patients, bakit ba na ganyan, ganito, it is easier for you to remember the different manifestations. So for your Cushing syndrome naman, the cause is female, so around 30 to 60 years old. We have your primary Cushing, so the cause is usually a tumor in the kidney, while your secondary is Cushing's disease. So yung problema ay nasa pituitary gland talaga. Iatrogenic, it could also be caused by iatrogenic causes, usually by different medical procedures. So your signs and symptoms, we have hyperglycemia, hypertension, hypernatremia, hypokalemia, truncal obesity, moon face, buffalo hump, pendulous abdomen. Sa mga babae, it could lead to your masculinization, decreased libido or sex drive, and also your osteoporosis, purple striae on the skin, or thin yung skin nila, irritability, frequent mood swings. All right. So please try to copy, if ever nagka-copy kayo, copy this first kasi parang ito yung super summarized siya. All right. Next, nursing interventions, corticosteroids. So when we give corticosteroids, give two-thirds in the morning and one-third in the afternoon. What else? We will, as much as possible, decrease stress. We want to prevent infection, reduce fatigue of the patient. Small frequent feedings, high carbohydrates, high protein, high sodium, low potassium levels. Complication that we have is your Addisonian crisis. So, yung parang drug of choice or your management for your Addisonian crisis is your fludrocortisone na IV. So, if you can see, your fludrocortisone is a steroid. So, IV siya. And then, for your Cushing syndrome naman, maintain skin integrity. The diet should be low in carbohydrates, low in sodium, low protein, high potassium level. Hypophysectomy if it is secondary Cushing's. Please remember, ano nga? Sige, answer sa chat box. Ano nga yung may problema or where is the cause of the problem when we say secondary Cushing's? Nasaan yung may problema? When I say secondary Cushing's, where can you find the problem? Very good. It's in your pituitary gland. Adrenalectomy naman for your Cushing's, for your primary Cushing's siya. Okay? Because yung may problema ay nasa adrenal gland siya mismo, not yung ACTH or not yung pituitary gland that is secreting your ACTH. And then we also want to prevent, of course, infection. Okay? So please copy before I will proceed to the Word document para isa-isahin natin. Okay, so we will start with your Addison's, okay? Addison's disease. So that you can easily remember your Addison's disease. Remember, add, okay? Add. Addison's, add. You want to add something. What will you add? You will add steroids, okay? Add steroids. So why will you add steroids? So what do you think is happening to a patient with your Addison's disease? Kulang ba sila sa steroids or nasobrahan sa steroids? Do you think na kulang sila sa steroids? Do they have decreased ACTH or increased ACTH? Very good. Kulang sila. Kulang. They are lacking. There is decreased ACTH hormones. That is why you want to add steroids. Okay? Again, that is why you want to add your steroids. So we have different causes. First is we have your autoimmune. So autoimmune, the body itself either attacks the adrenal gland or the pituitary gland. Aside from autoimmune, it could also be because of different diseases, okay? Different diseases such as cancer or infection, okay? When it comes to infection, it could be your tuberculosis or even your HIV, all right? Next is damage, okay? There is damage to the adrenal gland. Okay, the damage siya to the adrenal, or it could also be your pituitary gland. Okay, so pwede na trauma, due to trauma siya. All right. Signs and symptoms. Signs and symptoms. Add steroids. Again, if you add steroids, increase or decrease yung ACTH here. If you add steroids, increase or decrease? Very good, decrease. So please remember that Addison's is decrease. So it means your signs and symptoms all is decreased except for potassium. Let me repeat, all is decreased except for potassium. So we have hypotension or hypertension. Do we have hypotension or hypertension? Very good. We have hypotension. Do we have weight loss or weight gain? Weight loss or weight gain? Weight loss. Tachycardia or bradycardia? Do we have tachycardia or bradycardia? Very good. Do we have tachypnea or bradypnea? Tachypnea or bradypnea? Very good. Still the same. Bradypnea pa rin siya. Okay. Do we have alopecia or hirsutism? Alopecia or hirsutism? Alopecia is lack of hair, diba? Yeah, so we have alopecia. Ano pa? What happens to the patient's mood? Increase yung mood niya or decrease yung mood niya? Increase or decrease yung mood niya? Decrease. So there's a chance na the patient may have signs and symptoms of depression. What happens to your patient's energy levels? Up or down? Energy levels up or down? Down, diba? So yes, they can be lethargic. What happens to your patient's sodium level? Hyponatremia or hypernatremia? Very good. Hyponatremia. So as I've mentioned, all is decreased except for potassium. So ano yung potassium nyo? Hypokalemia or hyperkalemia? Hypokalemia or hyperkalemia? Very good. It's hyperkalemia. And let me add, okay, there is bronze-colored skin. All right? Bronze-colored skin siya. The bronze-colored skin, this is, ano siya, this is specific siya for your Addison's disease. Okay? Specific for your Addison's disease. What else? Hypoglycemia or hyperglycemia? Hypoglycemia or hyperglycemia, all is decreased except for potassium, so still hypogly. Okay, there is a risk for your hypoglycemia. So that is, diba, easy lang siya to remember when it comes to your Addison's. Kasi we know Addison's, you have to add steroid. It means na decreased siya. So if decreased siya, everything is down, everything is decreased except for your potassium. Okay? Next, we have here, ano yung treatment? Treatment or your interventions? Treatments or your interventions, first is of course, kulang kasi steroid, so you will have to add steroid, okay? Add steroid. Again, they end in zone, okay? They end in zone. Remember to increase the dose during stress, surgery, and if the patient is undergoing sepsis or infection. Okay? Kasi the body will be needing more steroids. Next, the diet of your patient. What do you think should be the diet of your patient? Up or down? Increase or decrease yung diet niya? Very good. Dapat increase yung diet. Why? That's my next question. Why should you increase your diet? Yes, very good. Aside from weight loss, it's also because, ano? Aside from low potassium, what happens to the patient's energy level? Di ba lethargic sila? Lethargic. So, poor yung energy. So, if poor yung energy, as much as possible, dapat increase in carbohydrates, increase in calorie intake, ganon. Okay? So, yes, that is correct. So, dapat the diet is high in calories, high in carbs, and also high in sodium because of your hyponatremia. Okay? Yes, because of your hyponatremia. So, what about yung potassium level? Should we advise or should we encourage to increase potassium level as well? No na, 'di ba? Okay, no na, very good. So, yung mga ganon, 'di ba, more on ano siya talaga, more on like common sense, 'di ba? Alam mo na yung manifestation mo is um all is decreased except for potassium. And then if like nakita mo lang diet high, so you will also dapat high rin yung potassium. So no. Okay? Next, when it comes to giving steroids, 'di ba? Very important yung steroids. Do not abruptly stop steroids. Okay? So, if ever you want to discontinue or you want to decrease the dose, how are we to do so? How are we going to do it? Very good. The word is taper. You have to taper it down. Okay? Is this a cure for the is this a cure or pang-manage lang siya ng sakit mo? Can this cure yung steroids? Can it cure? Yes, it cannot cure. It will only manage. All right. And then, dapat, if your patient has Addison's disease, of course, unfortunately, a lifelong hormone replacement na siya. There will be a lifelong hormone replacement therapy. All right. Next, let's proceed to the complication. The complication again is your Addisonian's crisis. Okay, Addisonian's crisis siya. So, how is this being manifested? This is being manifested by hypotension talaga, super low. So, it could lead to your hypotensive shock. It may lead to your hypotensive shock. So what is the management? The management is add steroid via IV push. So pwede yung fludrocortisone or mga hydrocortisone siya na mga medications. Pero dapat straight IV push. Hindi na siya pwede na oral-oral lang. Okay, it should already be IV push straight sa veins to save the patient. Okay? So this is all for your Addison's disease. So 'di ba? Chicken lang siya, as in very easy lang siya. 'Di ba? So please copy first so that you have your notes na. Okay? So again, that is for your Addison's disease. Do we have any questions, clarifications po ba? From the group, any questions? Okay. So if there's none, let's proceed to your Cushing's disease. Okay? Cushing's. Let's proceed. Okay, so your Cushing's disease, Cushing's, just remember Cushing, you have to cushion. Okay, Cushing, you have to cushion. Ibig sabihin ng cushion, naglalagay ka ng something to stop. Naglalagay ka ng something to stop. So, bakit ka naglalagay ng something to stop? Kasi there is too much ACTH or too much steroid siya. Okay? So, too much, 'di ba? So, meaning increase or decrease ba ito? Cushing's disease, increase or decrease? Very good. Increase. So, yan yung target word mo when it comes to your Cushing's disease. Increase siya. So, your causes, what are your causes? Long-term use of your steroid. Okay, what else? Tumor. So tumor in either the pituitary gland or in the adrenal. Okay, it may also be from your small cell lung cancer. Okay, small cell lung cancer. So what are your signs and symptoms? Signs and symptoms because it increase. So meaning everything is up except for potassium. Everything is up except for potassium. So what will happen to your blood pressure? Of course, hypertension, ano pa? Hyperglycemia, tachycardia, tachypnea, hypernatremia, weight gain, 'di ba? Pero except for potassium, so we have hypokalemia. Okay. Ano pa yung mga specific siya for your Cushing's disease? We have your truncal obesity. Truncal obesity. We also have your moon face and your buffalo hump. Okay, yes, correct. Ano pa? Do we have hirsutism or alopecia? So we have hirsutism here. Okay, hirsutism. Next, we also have purplish striae. Purplish striae, or ito yung parang sometimes they can call it as butterfly mark. Yes, very good. Okay? Ito yung mga signs and symptoms mo or manifestations for your Cushing's disease. Alright. So, ano yung treatment? What is our treatment or yung intervention? Treatment or intervention. So, you can do surgery. Okay? You can have a surgical standpoint or surgical intervention like, the hypophyseectomy or the adrenalectomy, and then slowly decrease steroids. So again, taper off. So it's always going to be wrong if they say na you will automatically discontinue your steroid even if yung body ni patient or yung isang patient punong-puno na siya sa steroids. Kasi hindi it's really not allowed to automatically discontinue the steroid. You really have to taper it. Okay? Taper it slowly. So that is all for your Cushing's disease. Sige, please copy everyone. Okay. Sige. Next, let's talk again about your steroids. Okay, let's review about your steroids kasi steroids, 'di ba? I've said this yesterday, it's like your wonder drug. Wonder drug siya. So steroids, they end in zone, 'di ba? For example, we have your prednisone, your dexamethasone, your hydrocortisone, your mga fludrocortisone. So this is given, ano ba yung indication to? Given siya sa mga patients with inflammation and stress. Not just inflammation, but also stress. Can you tell me, ano ba yung mga iba't ibang sakit wherein you can give your steroids? Sige nga. COPD, very good. Kasi with your COPD, there is inflamed yung lungs niya. RA, very good. Rheumatoid arthritis, pwede rin because inflamed yung joints. Inflamed yung joints. What else? Asthma, very good. Lupus, very good. That's correct. Lupus, basically, yung problema because it's an autoimmune disorder. Inflammation talaga yung main problem. Okay? Ano pa? Psoriasis, pwede rin siya kasi inflamed yung skin. Tip, basta patient mo may autoimmune disorder or autoimmune disease, anticipate one of the medication will be steroid. As in, it's always going to be in the treatment regimen. Okay, again, once that your patient has autoimmune disorder, automatic may steroid yan sa kanilang mga gamot. Okay? There's going to be steroid. So, with your steroid, we have, although it's a wonder drug, pero may mga iba't ibang precautions siya. Okay? There's going to be precautions. So, risk for precautions, first, risk for weight gain, as I've mentioned, 'di ba? Risk for weight gain siya. So, take note niyo ha sa mga sa mga questions, like whether it be, especially like usually NCLEX to, if may mga words such as sudden, excessive, rapid, when it comes to weight, you have to encircle that and parang think of it as like a red flag siya na word. Meaning it's not normal. Ganon. Okay? It could mean na your patient is having weight gain siya or nagsuswell siya. Okay? Next is your patient will be risk for infection. Okay? Next is risk for your hyperglycemia. So there will be increase in sugar. Next is risk for osteoporosis. Okay? Again, your steroid decreases the absorption of your calcium to the bones. Okay? And then last is risk for cataract formation. Okay. So how do we prevent your crisis? How do we prevent your crisis? Paulit-ulit, paulit-ulit is slowly taper off the medication. Okay, slowly taper off the medication and then increase the dose if the body will undergo any stress. Okay? So you have to increase the dose if the body will undergo any stress. It could be a lot of factors such as your patient will undergo a surgery. So pwede rin, you have to increase the dose. Ano pa? You will also have to increase the dose if your patient is suffering from an infection or suffering from a sepsis, ganon. Okay? So, ito, please, please, please copy or take note talaga to si steroids. As I've mentioned, hindi mo lang to makikita sa um, endocrine, but in a lot of different, especially sa MS, in a lot of different disease or disorders as well. All right. Do we have any questions? Any questions or clarifications? Yes, whenever I pause po, it's parang I'm giving you time to copy if ever or think if may mga questions po kayo. Questions, clarifications. Silence means wala. Okay. Let's balik po tayo sa may ano. Ay, sorry ha. Are you done na with copying? If hindi pa po kayo tapos, you can tell me talaga. Okay? Okay, so we have here a picture, no? So this is your Addison's, 'di ba? Thin siya, mababa yung blood pressure niya. And then ito naman your Cushing's. Ito yung kita mo ito, yung buffalo hump, moon face, malaki yung face niya, truncal obesity. Ano ba yung ibig sabihin ng truncal obesity? Take note sa mga NCLEX takers. Sometimes they are going to describe it as truncal obesity as central obesity siya. However, yung extremities are thin. Thin extremities. Again, that would be a thin extremities but with a central obesity. Central obesity and thin extremities siya. Thin limbs, thin arms. Yeah, thin legs. Okay? And then hairy sila because of, hirsutism. And then, bakit sa paa niya, bakit may mga wounds? Bakit parang unhealing, not non-healing yung wounds? Sige nga, bakit? Why do you think may mga non-healing wounds dyan? Very good po, Ma'am Rhea, because of your hyperglycemia. So, di ba, with your hyperglycemia, if the patient's blood sugar level is increased, usually, ano talaga, poor yung wound healing because yes, poor na yung blood flow kasi yung the concentration of the blood is very concentrated. Very concentrated. So, if very concentrated, very malapot. Malapot, 'di ba? Concentrated, very viscous. Very viscous yung blood, very malapot. Bad na yung blood flow. Bad na yung blood flow. So, there is less tissue perfusion that is going to the different body parts. Ganon. Especially sa mga extremities. Yes, that's correct. Matagal yung circulation. Okay. So, next. Let's proceed. So this is for your Addisons and Cushings, okay? Just remember, Addisons, you have to add steroid. Bakit ka mag-a-add ng steroid? You will add steroid because ano? Because ano, you can send your answer sa chat box. You have to add steroid kasi what is happening? Very good. Low or decrease yung steroid hormones in the body. So, yung signs and symptoms ng Addison's disease, everything is up or down. With your Addison's, everything is up or down. Tama. Everything is down except for what? Very good. Except for potassium. Okay? And then what else yung isa? Yung one when it comes to the skin that is specific for your Addison's disease. Ano yung skin ng mga patients with your Addison's disease? Yes, correct. They have bronze-colored skin. Bronze-colored skin siya. Okay? How about for your Cushing's disease? For your Cushing's disease naman, it's your 'di ba? Everything is up except for your potassium. So Addison's disease, everything is up except for your potassium. All right? So if everything is up except for your potassium, it means na may mga hypertension, hyperglycemia, ganon. Okay? So that is for your Addison's and your Cushing's disease. All right? So let us proceed na sa your pheochromocytoma. Okay, what is pheochromocytoma? So your pheochromocytoma, ito naman yung excessive production of your epinephrine and your norepinephrine. So I think yesterday I've discussed this. What do you call, what is the general term for your epinephrine and norepinephrine? The general term for your epinephrine and norepi is catecholamines. Correct. Your catecholamines. So your catecholamines are basically your epi and norepi. Another question. Ano yung function ni epi and norepi mo sa katawan? Do they stimulate or do they inhibit? Do they stimulate ba or do they inhibit? Stimulate meaning increase, pinapa-increase. Inhibit, pinapa-decrease. Very good. Stimulate. That's why, for example, if ever nag-flatline na yung patient mo and then you have to do, code blue na CPR and all, nagbibigay ka ng epi. Bakit ka ba nagbibigay ng epi? It's to restart the heart, 'di ba? It's to help restart the heart para to stimulate the heart to beat again, ganon. So, if nasobrahan ka ng epinephrine and norepinephrine, what do you think will happen to your vital signs? Increase or decrease? If you if you have too much epinephrine and norepinephrine in your body because your body is producing so much catecholamines, what will happen to your vital signs? What will you expect? Increase or decrease? Okay, of course, very good. Increase. Kasi 'di ba, epinephrine as what we've mentioned, nag-stimulate siya. So mag-i-increase. So, ito yung problema mo, 'di ba? So, it's most commonly found sa mga 25 to 30-year-olds and it is hereditary. So, ito yung acronym, PEG. P is for palpitations. Bakit ba nagpa-palpitate ka? Kasi nag-i-increase yung heart rate ni patient. Super duper fast yung heart rate. There is also hypertension. Yes, of course, kasi increase yung blood pressure kasi nga nagsistimulate. Excessive sweating and again, increase in glucose as well. Okay? So may hyperglycemia. Pero most usually yung main manifestation or yung nakakatakot talaga na manifestation with your pheochromocytoma is super duper high C blood pressure. As in, nagka-hypertensive crisis talaga siya. So, that's why it's abnormal, di ba? Kaya nga nakakatakot siya because it could lead to your hypertensive crisis. So, pwede na like magbibigay ka ng, medications to lower down your blood pressure. So, pwede you can start your nicardipine drip, ganon. Okay, your VMA, what is VMA? Hindi siya GMA. It's your VMA, this is your vanillyl mandelic acid. So, this is a diagnostic test to check if your patient has pheochromocytoma. Again, this is a diagnostic test to check if your patient has pheochromocytoma. So, paano ba to? This is a 24-hour urine collection. Okay? 24-hour urine collection. So, your 24-hour urine collection, it's a type of urine collection, di ba? Part yan ng fundamentals of nursing. You might think it's basic, but a lot of times nakakalimutan natin yan kasi super focused tayo sa like MS and like mga disease process and funda, nakakalimutan natin. However, it's very, very important kasi ginagawa talaga natin yan. As in, those are nursing interventions or, nursing procedures talaga. So, I have a question. How will you collect a 24-hour urine collection? Let's say your patient woke up at 7 a.m. Okay? Your patient woke up at 7 a.m. and then yung first voided urine niya is at 8 a.m. Will you collect it already? Will you start collecting the first voided urine? Yes or no? Very good. No. You discard the first voided urine. Yung second voided urine niya is the one that you start collecting. So, 'di ba? Again, your patient woke up at 7 a.m. First voided urine is 8 a.m. Discard mo. Second voided urine niya, let's say 10 a.m. So, at 10 a.m., that is when you start collecting. Okay? You start collecting it and then yung ihi ni patient, where will you put it? Saan mo siya ilalagay? In a container, of course, 'di ba? Pero yung container na yon, saan mo ilalagay? As in like, nasa room lang ba? Or nasa freezer? Or saan? Correct. Nasa ref siya. Okay? As much as possible, nasa ref. Or pwede rin siya nasa loob ng ice box. Ganon. Pero hindi siya pwede na nasa room temperature lang or nasa room lang siya because ma-expire talaga yan. Alright? Okay. So, di ba, 24 hours, you will continuously collect it for 24 hours. When will you stop collecting the urine the next day? At 8 a.m. or 10 a.m.? 8 a.m. ba or 10 a.m.? Kasi 'di ba, yung first voided urine ni patient 8, yung second voided urine niya is 10. So when will you stop collecting? 8 a.m. or 10 a.m.? 8 or 10? 8 or 10? Okay. Best answer is 8 a.m. the next day. Okay? 8 a.m. the next day. Meaning, you stop collecting sa um, during that time na na-discard mo yung first voided urine the other day. Kasi, when you discarded that first urine, you are already starting the 24 hours. Like, example, if nagka-countdown kayo, prines mo na yung play sa stopwatch. Sorry, hindi play, yung start button. You press the start button na sa stopwatch. So, 24 hours siya. Okay? So, any urine until 8 a.m., you can still collect it. Pero, let's say, 9 a.m., do not collect it anymore kasi sobra na siya ng 24 hours. Okay? So, anyways, that is for your 24-hour urine collection. And when we collect your VMA, to check for your VMA, we use the 24-hour urine collection tayo dito. Okay? Nursing interventions, of course, antihypertensives. So usually if the blood, why po second urine, ma'am? Kasi if you collect the first voided urine, hindi siya, parang you want the bladder to be sterile. You want the bladder to be sterile as much as possible. Okay? It's like, kasi if you will, from 8 a.m. pa lang, you will already collect it. Hindi ka sure na if saan talaga yung naging 24 hours. Ganon. So, parang if you collect the 7 a.m., it means na nag-empty yung bladder mo. So, parang nagsa-start ka talaga. It's just like para to ensure lang talaga na magiging 24 hours yung urine collection. Okay? All right. So going back, antihypertensive. So as I've mentioned, usually if the blood pressure is too high na, mga nicardipine drip na kayo, expect that already. Monitor urine tests for your glucose and acetone. Avoid stimulants such as coffee and tea. Ganun. Hindi lang coffee and tea. Ano pa yung mga ibang stimulants ba? Correct. Mga soft drinks. What else? Carbonated drinks, soft drinks. What else? Chocolate, correct? Also, ano pa, mga spicy food. Stimulants rin yan eh, mga spicy food. Tobacco, yes. Smoking, alcohol. Although alcohol is a depressant, pero we also have to avoid that. Okay? So please copy for your pheochromocytoma and then we will proceed. Okay, let's proceed. Okay, adrenalectomy, ectomy. What does it mean when a word ends in ectomy? Removal. Very good. Removal. So this one is the removal of the what? Removal of the adrenal gland. Tama, of course. Removal of your adrenal gland. So this is a removal of one or both of your adrenal glands. Um, this is usually done for primary Cushings or your pheochromocytoma. Pre-op, correct the metabolism problem. Cushing's naman, treat hyperglycemia and protein deficiency because, diba, remember, for your Cushing's disease, we have your hyperglycemia. And for your pheochromocytoma, as much as possible, as what I've mentioned, yung delikado talaga is your blood pressure. So you want to regulate your blood pressure. Administer corticosteroid pre-op to prevent your adrenal insufficiency. For your post-op interventions, complications is hemorrhage. So, question, if nag-hemorrhage yung patient mo, what will you expect to happen to the vital signs? What will happen to your blood pressure? What will happen to your pulse rate? What will happen to your respiratory rate? Okay, remember, hypo, tachy, tachy. Okay, remember yan. Those are like mga easy to remember na mga like tips and tricks. Hypo, tachy, tachy. Hypotension, tachycardia, tachypnea. Okay? Infection as well. Pero if um, NCLEX, sa mga kukuha ng NCLEX, if the question is, the patient just had his or her surgery 5 hours ago, what is your priority complication? Again, the patient just had a surgery 5 hours ago. What is your priority complication? Letter A, hemorrhage. Letter B, infection. What's your answer? Correct. Answer is hemorrhage. Okay? Yung infection, that will only be a problem or that will only be like a priority usually after 3 days na siya. After 3 days of post-op. Pero like within the first 12 hours, hemorrhage. Hemorrhage is one of the most important complications that you should watch out for. Next, administer corticosteroids to maintain the levels. And then if bilateral, meaning both of your adrenal glands was removed, so lifetime replacement of hormones. Embolism, yung mga embolism, like your DVT, ganon. Um, I mean, there's going to be a lot of different problems or sorry, complications. Like sobrang marami. Pero yung mga like, mga common talaga number one is hemorrhage. Ganon. Bilateral, lifetime replacement of hormones siya. And then unilateral is meaning only one part, only one of your adrenal gland was removed. So 6 to 12 months until remaining adrenal gland is functioning. So meaning you have to be giving hormone replacement for 6 to 12 months or until you are sure na okay pa yung naiwan na adrenal gland. Okay? So please copy for your adrenalectomy. All right. Do we have any questions or clarifications, Nurse Has? May questions ba tayo sa Cushing's and your Addison's disease? Bilateral, di ba? Sige nga. After bilateral removal, do we still give steroids? Do we still give steroids? Not hormones? Yes, you can still give steroids. Why? Kasi wala ka ng I mean, if wala ka ng adrenal gland, wala ka ng hormone na nagpo-produce ng like normal steroids or natural steroids, parang ganon. Optional or not, it would really case to case talaga yan. Situation depende sa patient. Pero I will say yes, kailangan siya. That's why lifetime replacement of hormones. It depends on what kinds of steroids. We have sex hormones, those steroids, ganon. Okay, do we have any questions pa po ba? Sige. So if we have no questions, before we will proceed with your hypothyroidism, with your thyroid problems, let's have a short break muna, okay? Like CR break, water break muna tayo, stretching break, okay? So 10 minutes, okay? We will be back after 10 minutes. Okay, if you have any questions, send nyo lang dito sa chat box. All right? Alright, good afternoon, good evening na pala, no? Hello! Sige, we're back. Let us continue with your hypothyroidism and your hyperthyroidism. Alright, so hypothyroidism and hyperthyroidism. So this, of course, involves your thyroid, diba? Your thyroid gland siya. So what is the cause for your hypothyroidism? Mostly, this is due to mixed edema for adult cases, or the other name is your Hashimoto's disease. It could also be an autoimmune disorder such as your thyroiditis, or it could be from your congenital hypothyroidism. We call that your cretinism. Or primary hypothyroidism naman, thyroid gland. Secondary hypothyroidism, the problem is your pituitary gland. So, if na-notice ninyo, basta primary, okay, like a while ago with your primary Addisons, basta primary, yung problema is the gland mismo or the organ mismo. Pero if it's secondary naman, then yung problema is your pituitary gland. Okay? The complication here that we have is your mixed edema coma. So, if you have mixed edema coma, ito yung mga manifestations or signs and symptoms. It could lead to comatose. Yung risk factor is infection, stress, exposure to cold, use of sedatives or your narcotics. And then for your hyperthyroidism naman, so primary hyperthyroidism, thyroid gland is the problem, while for your secondary hyperthyroidism, pituitary gland is the problem. So it is more common sa mga babae, so women ages 30 to 60 years old. This time, the complication, we call it your thyroid storm. Okay, your thyroid storm, or that is your thyrotoxicosis. The other name for your hyperthyroidism is Graves' disease. All right, sorry. So please copy this first, okay? This is just an overview. We will be discussing more after these slides. All right. Next, signs and symptoms. Hypothyroidism decreased everything. So we have fatigue, lethargy, slowed mental processes, anorexia, but has weight gain, constipation, intolerance to the cold, dry, scaly skin, sparse hair, brittle nails, amenorrhea, bradycardia, cardiac complications, increased sensitivity to sedatives, narcotics, and anesthetics. Ano pa, low cholesterol level and low T3 and T4. Okay, so 'di ba? Looking at this, very intimidating, right? Parang It's really hard to memorize. So let's try to copy this first and then let's try to discuss it isa-isa na mas in an easier way siya. Okay, let us discuss about your hypothyroidism and hyperthyroidism kasi mga favorite to ng both PNLE and also your NCLEX. Okay, let's start with your hyperthyroidism. All right, hyperthyroidism, hyper. If you see the word hyper, what will you think or what comes in your mind when you see the word hyper? Increase or decrease? What comes in your mind when you see the word hyper? Very good, of course, diba? Increased siya. So there is increased thyroid hormones. Okay. So let's first start with your labs, the laboratory. Okay. When it comes to labs, you only have to remember three things or three laboratory tests. T3 and T4, tsaka TSH. Okay. T3 and T4, tsaka TSH. T3 and T4 and TSH. So, di ba, there are three different laboratories or laboratory values. However, you only have to memorize talaga or remember dalawa lang. Kasi T3 and T4 will always be the same. Okay, T3 and T4 will always be the same. Meaning, if increase si T3, T4 will always be increased as well. Alright? Okay, let's start here. Hyperthyroidism. Diba? Hyperthyroidism, we said na your body has too much thyroid hormones na. Diba? Again, your body has too much thyroid hormones. So, the first thing that you will analyze is for your TSH. TSH is thyroid stimulating hormone. Again, thyroid stimulating hormone. So, do you think there will still be an increase or decrease in thyroid stimulating hormone sa isang tao na marami ng thyroid hormones? Ano siya? Low or high? Thyroid stimulating hormone, meaning it's a hormone to stimulate the thyroid. So, do you think madami pa? Or do you think increase or decrease siya? Okay, very good. Of course, dapat low na. Low TSH na kasi sa isang patient with hyperthyroidism, mataas na yung thyroid hormones. I hope you understand. Okay, again, let me repeat that. Mababa yung TSH, there will be low thyroid stimulating hormone kasi sa isang patient with hyperthyroidism, mataas na yung thyroid hormones. So it means na we do not need hormones to stimulate the thyroid anymore. Kasi marami ng thyroid hormones sa patient na ito. Okay? I hope you understand that. I hope na-absorb niyo siya. Okay. And then, what is easy here is if si TSH, automatic opposite si T3 and T4. So if low si TSH, automatic opposite si T3 and T4. So if low si TSH, high si T3 and T4. So basically, you just really have to analyze the TSH. Kasi if si TSH, yung opposite niya, that will be your T3 and T4. Okay? Your hyperthyroidism, the other name for your hyperthyroidism, again, is your Graves' disease. Again, is your Graves' disease. Let's proceed to the signs and symptoms. So what you have to follow here, or what you have to remember, is all is high except for weight. Again, all is high or all is up except for weight. So do we have weight gain or weight loss? So do you think we have weight gain or weight loss? Okay, all is high except for weight. So we have weight loss, of course. Ano pa? All is high. So dapat hypertension, ano pa? Tachycardia, tachypnea. Okay? What else? We will also have palpitations, 'di ba? Ano pa? What will happen to your GI? Diarrhea or constipation? Very good, diarrhea. Okay, diarrhea because, 'di ba, increase man yung GI motility. That's why diarrhea siya because increase the GI motility. Next is what else? There will also be they are heat intolerant. Okay? Heat intolerant sila. Okay? So if they are heat intolerant, what happens to their skin? Is it dry? Dry skin ba or moist yung skin? Dry yung skin or moist yung skin? This is where confusion happens. Heat intolerant, if you are intolerant to heat, parati kang naiinitan. So if parati kang naiinitan, parati kang ano, very good. You are always sweating. So if nagsusweat ka, ano yung skin mo? Dry ba or moist? Very good. Moist or sweaty skin dapat. So please remember that. Okay? Moist or sweaty skin. What else? There is also presence of your exophthalmos. Okay? Exophthalmos, this is your bulging out yung eyeballs. Okay? And presence of goiter as well. Okay? Exophthalmos and your goiter. So what is your complication here? The complication here is your thyroid storm. Okay? Thyroid storm. So basically, si thyroid storm, yung the main signs and symptom talaga is agitation, confusion. What else? There is hypertensive crisis. Okay? Agitation, confusion, and hypertensive crisis. So, this is the complication. Like, for example, hindi na manage ni patient yung hyperthyroidism niya. So, pwede na it could lead to your thyroid storm. So, let's proceed to your diet. What do you think should the diet be? High or low? Very good. So, there will be high. So, dapat 'di ba, the patient is having weight loss. So dapat high calories dapat. High calories, high protein, high carbohydrates. How about fiber? High fiber diet or low fiber diet? Very good, low fiber diet. What else? No caffeine, no spicy food, no alcohol, ano pa? No smoking. Okay? Include those as well. Alright, so this is for your hyperthyroidism. So I hope na na-understand. So I'll give you time to absorb it. Alright, so do we have any questions po, nurses, with your hyperthyroidism? If not, I will proceed to your hypothyroidism na. Okay? Hypothyroidism. So hypothyroidism, 'di ba? It's just going to be the opposite of your hyperthyroidism. Okay? So with your hypothyroidism, decreased yung thyroid hormones. All right? There is decrease in your thyroid hormones. The other name is tapos na po hypo. What do you mean done? Decreased thyroid hormones. Yung na-discuss, what we've just discussed is hyperthyroidism. Other name is your Hashimoto's disease. Okay, Hashimoto's disease siya. Okay, so what do you think will happen to your laboratories? Okay, so again, yung laboratories T3 and T4, tsaka TSH. So, diba, I said na you have to analyze the TSH first. So, what will be the TSH of your patient here with your hypothyroidism? Is it high or low? Very good. High. High dapat yung thyroid stimulating hormone. Why? Because with your hypothyroidism, mababa yung thyroid hormones. Kaya kailangan mas maraming hormones to stimulate the thyroid. Kaya nga dapat mas maraming TSH. And then, what will happen to your T3 and T4? Opposite lang talaga siya. So, low T3 and T4. Okay? So, your signs and symptoms, all is low except for weight. All is low except for weight. What will happen to your weight? Weight gain or weight loss? Do we have weight gain or weight loss? Very good. We have weight gain kasi 'di ba low yung metabolism. What will happen to the energy? Low energy as well. So, expect may mga fatigue, may mga weakness, ganon. What else? Low rin yung digestion. So, if low yung digestion, will this be constipation or diarrhea? Low digestion meaning low rin or mahina yung pag-move ng GI mo. Yes, that is constipation. Okay, and then we will also have alopecia, depression, apathy, ganon, low libido, so meaning low yung sex drive. What else? They are cold intolerant. So if they are cold intolerant, what happens to their skin? Is it dry skin or is it moist yung skin? Very good, dry skin. Okay? There can also be presence of your amenorrhea. So ano yung complications natin dito? The complication is, we call that your mixed edema coma. Okay? Mixed edema coma. So just imagine yung vital signs lahat mababa. Hypotensive shock na, ganun, low respiratory rate. So if low yung respiratory rate, watch out for respiratory failure. Okay? If low na yung respiratory rate, watch out for your respiratory failure. So, dapat prepare na, like, you already have to prepare ET setup. Like, intubation set or your endotracheal intubation na siya. Alright? The diet, high calories or low calories? What do you think will happen to the diet? Of course, very good. Low calories dapat siya. Okay? Kasi, again, your patient is suffering from weight gain. And, of course, like, low na rin yung metabolism niya. Mm-hmm. Yes, the medication, yes, tama po, yung mga anti-thyroid meds. Okay. We will be proceeding to the medication after your hypothyroidism and hyperthyroidism. Pero medyo mahaba-haba siya. So I think I will be discussing it na lang sa next natin na session so that hindi mabitin and then so that hindi rin na minamadali yung medication, yung pharma when it comes to your hypothyroidism and hyper kasi those are also mga very, very common na mga NCLEX and PNLE questions as well. Okay, as well as the different interventions such as thyroidectomy kasi like alam niyo naman sa thyroidectomy, that's the removal of the thyroid. Maraming complications naman diyan, 'di ba? It could lead to your hypoparathyroidism, ganon. So if nagka-hypoparathyroidism si patient, it could lead to decrease in electrolytes, ganon. Ano pa? Ano ba yung mga ibang complication? We also have your thyroid storm, ganon. Alright? So anyways, going back, this is for your hypothyroidism. Alright, do you have any questions from the team? Hello, do we have any questions po or clarification? So today we've discussed hypothyroidism, hyperthyroidism, and also your Addison's and your Cushing's disease. So yung next ko po na session, I will be continuing with the pharma, with the medications and the interventions when it comes to your hypo and hyperthyroidism. And DM na tayo, diabetes mellitus. Okay, sa DM, aside from the DM, we also have your DKA, your diabetic ketoacidosis, and of course, your HHNS. All right, we have no more questions. Like to thank. Okay, so if wala na pong questions, thank you so much for giving me your time. I know it's a Sunday, it's a family day or it's supposed to be a rest day. Yung iba off pa nila, no? So, yeah, yes, thank you so much for being here. Ano siya, yung dedication, I'm sure talaga na yung dedication nyo, yung hard work nyo, it will really pay off talaga. So just keep on reviewing and then yung na-learn ninyo, if like, diba, nagte-take notes kayo, you have to review it. Okay, balik-balikan nyo. Or you have to review it talaga, always. Hindi lang siya na, nasa notes lang siya, or hindi na nagre-review lang kayo ngayon during the live sessions. Dapat yung mga notes na tinake nyo, you really have to review it on your own. Kasi hindi naman yan na mag-e-enter na agad-agad sa mind. 'Di ba? So yes, sa mga everyone who's planning to take the NCLEX soon, so um, konting push na lang, 'di ba? And then for sa mga PNLE takers who's going to take it this February as well, 'di ba? So, ganun, if you have no questions anymore, once again, thank you so much everyone and I will see you again very, very soon. Thank you everyone. Have a blessed Sunday to all.